You're tuned in to Women in America, the podcast that dives deep into the issues shaping gender equality in the US and beyond. Hosted by Pari and Eve, public health professionals by day and content creators by passion, we bring you expert insights and actionable strategies to push the fight for equality forward in today's America. On this episode, OBGYN physician Dr. Kristin Lyerly brings us into rural hospitals across the country and tells us firsthand how abortion restrictions are impacting even places where abortion is legal. Let's dive in. Today we are joined by Dr. Kristin Lyerly, and I wanted to specifically bring her to the table because, as some of you might know, a couple of hours ago, our government shut down, and the entire crux of the shutdown is the healthcare of Americans. Regardless of what Republicans might want you to think, it is about the healthcare of Americans. And, you know, we talk a lot to lawmakers, we talk a lot about what's going on in Congress, but today I feel like we need to step away from Washington, D.C. and start to think about how this shutdown is going to be affecting everyday Americans. So the reason why I asked Dr. Lyerly to join us today is because she is on the ground providing care to patients every single day and is seeing firsthand in her life, in her both her personal and professional life, the impacts of what is happening in Congress. Dr. Lyerly, thank you so much for joining us. Tell us a little bit about yourself before we really dive into what you've been seeing.
Thank you so much, first of all, for having me, and thanks everybody for joining us. This conversation is so long overdue because we live in the same place. You know, the public health, your public health is the foundation of your personal health. If we don't have health in our country, in our states, in our communities, we can't have our individual health. And our public health is so at risk right now. Mm-hmm. So I'll just back up and do a quick little intro. I'm Dr. Kristin Lyerly. I live in Green Bay, Wisconsin, but I practice in northern Minnesota, rural northern Minnesota. And that's because my name is on the judgment that brought abortion back to Wisconsin after the Dobbs decision. And because of that, anti-abortion foes went after my medical license, and they really threatened me and made it very hard for me to practice here in the state. So I went to a safer state, but I got to tell you, Minnesota is a great state. It actually got better after Dobbs, but it's still not easy to practice in northern Minnesota. And I still have a hard time getting access to medication abortion, mifepristone. I send my patients online to get their mifepristone because I can't hand it to them there at the hospital. So it's not just the state.
Tell me why that's the case.
The culture. We have attempted, mifepristone is challenging to get. So in some states, you can just go to the pharmacy and get it. In other places, a lot of doctors' offices will have it there in the office. So when you come in with your miscarriage or you want an abortion, your doctor can give you the Miffy, but we don't stock it there because we're afraid. And that's really what it comes down to. In the community, because mifepristone is related to abortion and because abortion is so taboo in so many of these rural communities, that it's a lot of barriers and they just have not been willing to stock it. So I've been sending my patients to Aid Access, which is usually my go-to.
But so this is I know we're just starting to get into your intro, but I feel like I want to pause right here because this is the crux of what Eve and I talk about all the time is one law can make a difference across the country, whether or not people realize it, right? Because in your case, you're explicitly saying it's completely legal, and yet it's just vibes that is making people stop doing this, And I think that that's so important because it is not just a legal conversation we have to be having, but also the cultural conversation, and making clear that mifepristone is the same medication used for miscarriage management. There is multiple uses to a drug, and ultimately abortion is healthcare. And it's I know it in principle, but to hear in practice that in a state even in Minnesota, that not even the law is stopping people from doing the bad thing. So that's so challenging. I'm sorry that you have to deal with that, especially as a provider.
I do whatever I can for my patients. I don't care if they voted for Republicans or Democrats or if they're disengaged, because when you walk into my exam room, you've got a problem and that problem needs to be solved. And you need all of your alternatives. So we have a conversation about you, what you need, how it fits into your life, and then I fight to get you the resources that you need. But, to your point about that chilling effect, about the vibe, Perry, I'm in Wisconsin, because the abortion law has changed so much over time. And again, just today here in Wisconsin, we are pausing abortion care at all the Planned Parenthood clinics in Wisconsin. This is Trump's backdoor abortion ban. This is the Planned Parenthood defunding that was in Trump's terrible tax bill. So they're just taking a moment to not provide abortion care while they determine what the law actually means for them. So Planned Parenthood will still continue to provide all of the other services, which is 96% of their business.
Mm-hmm.
But that abortion care in Wisconsin, I, we don't have a lot of abortion clinics here, but Madison, no longer providing care. The clinic in Milwaukee, no longer providing care. Sheboygan, no longer providing care. The only place you can get an abortion in Wisconsin is in Milwaukee now. There are 2 independent clinics. So it's not easy if you live in the middle of the state. If you live in northern Wisconsin, it's almost impossible. And further, the chilling effect makes it really hard for doctors to know what the law says, what
Mm-hmm.
they can provide their patients, and for patients to ask. It's hard to even ask or to know who to go to. So thankfully, we have programs like Mayday Health online where you can just go there and ask your question and know that you're going to get real information, not misinformation, and they're going to point you in the right direction.
Yeah. That's like probably tens of millions of women of reproductive age then that now have to travel to an entire city, like a different city in which they live in order to access basic health care. And that's crazy because it's not just Wisconsin where we're seeing that, right? Like we've seen that in multiple states across the US. And it is the reason I call it crazy is because it is actually quite wild if you think about the concept where like all Americans live in the United States of America, and yet your zip code is the one now determining your access to care, regardless of citizenship, regardless of wealth status. And then of course, once you have that geographic distance between you and a healthcare clinic, then all of the other socioeconomic factors like your wealth, your race, all of your other abilities to go get things is what is makes the difference for you, right? And I I'm like hearing what you're saying about how it makes it challenging for both doctors and doctors and patients to even like know what questions to ask. And frankly, in the last 2 years, it has felt like a barrage of news headlines around this. So you're also not sure if the status has changed since the last time you had a conversation with your doctor or your patient, right? Um,
Yeah.
and I know that, like, for me, when I was pregnant, and I live in a state with a pretty severe ban, but I was like, so, I was just so like, I don't care what the law says. Like, I believe what I believe. And so I went into my OB's office, immediately was like, hey, if you don't stand for this, I'm going to go find another provider. Like, I need to know what your stance is on this. And obviously, I stuck with somebody who like thinks the exact same way as me. But yeah, I recognize that, like, I have that bold comfort because of like the strength of my belief as part of like who I am, but not everybody is able to do that. And not everybody is even able to necessarily have like a full on conversation in proficient English where they're actually understanding everything that their doctor is telling them, right?
Yes. I'm so glad that you mentioned that. I mean, the English piece, but especially it all ties together. You have to feel like your doctor has your best interests in mind. And there are a lot of doctors out there, including OBGYNs, who are not pro-choice. They are not pro-abortion.
That's
They,
crazy.
I know. And I hate to share this news, but I think if that's what you're seeking, well, first of all, you have to work up the courage to be able to even trust the person that you're going to. Because
Hmm.
in that environment, once it comes out of your mouth, you don't control that message anymore. And then somebody knows that something very personal is going on, and you don't know if you're going to get in trouble, if other people are going to find out. It's so hard. But then if your doctor is not aligned with you, and as I said, there are many doctors out there who aren't, that's really scary. So to come out with that question and to know that if that's not the right person for you, you can find somebody else. That's really, really important. Whether we're talking about abortion or vaccines or preventive care, you have to have a therapeutic relationship with your healthcare provider.
Absolutely. And I think that, we're seeing this not just in like one-on-one relationships, which is where it's really important, but even at the organizational level, right? Like you have been talking about ACOG, and I would love if you could tell us a little bit more about that. But like people are looking to these like organizations as bastions of like representing evidence-based information and so on. And I find that because I'm a public health professional, I know who the organizations to trust still are in this space, but it's getting harder and harder for like the average American to decipher which organizations are like getting their evidence from sources that are actually qualified and informed and unbiased versus which ones are being influenced. So tell me a little bit about like how your position with ACOG and like your role with them has sort of allowed you to feel more comfortable or not in this space.
For full disclosure, I serve on the executive board for
Mm.
ACOG, the American College of Obstetricians and Gynecologists, but I am not representing them today in our conversation. But the reason I serve on the executive board is because I've been involved with ACOG since I was a medical student. So it's been over 20 years. This is an organization that is leading the way. They have an initiative to reduce misinformation and disinformation. They've got real substantial patient information on their website, which is ACOG.org. They pushed back on the Trump administration when it came down to federal funding. We worked together on some preventive care initiatives, reducing maternal mortality or moms who die related to their pregnancy. We got federal funding that we have since said we're not going to accept that because we cannot comfortably comply with the executive order, which is gray and challenging and not the best thing for us and our patients. So we are self-funding those programs now. We didn't drop the programs, we're self-funding them because we know that we have to continue to pursue the entire spectrum of women's health, from abortion to menopause care. So I am thrilled about the direction that this organization is taking in this terrible environment. ACOG is the only medical organization that is specifically named in Project 2025. We know that we are in the bullseye of the Trump administration, and that makes us know that we have to be courageous for ourselves and especially for our patients.
Yeah. I mean, first of all, I think it's really brave and bold of ACOG to take that stance because we all, for those of us who are in the weeds about this, we know the implications of like losing that kind of federal funding is like you are now making the very hard choice between saying that women, folks who need care, are not going to be able to receive it, or we're going to direct funding to that regardless of what else fails from an organizational perspective. So I think that that's valid. And that's the reason I actually wanted to ask you about that. I know that you're not here today in that capacity, but I think that it's important for folks to know that there are still places that they can go to get evidence-based information that are still fighting the public health fight as opposed to like the political fight. So I think that's valid. And I am curious from your perspective now as a individual provider, especially in a rural context, what are you seeing with your patients? We are hearing in the news already, like it's only been, I think, a month and a half since the big, beautiful bill, which I like to call the big bullshit bill, was signed. And we're already hearing news of rural hospital closures, right? I believe that Georgia was one of the first states to experience hospital closures. It's now spread, I believe, to 4 other states. And I'm lifting this up because I think people are not necessarily understanding that it has already begun. Like, I mean, it's going to continue. We're going to continue to see it for, I think, frankly, a decade to come, but it's already begun. And the government shutdown was just 12 hours ago, but the consequences of the actions of what's happening in Congress have started. And I'm wondering, are you starting to see that reflected in your practice, in your, like the work of your colleagues, the networks that you have?
We've been seeing it. In Wisconsin, where I live, we've lost over half of our rural obstetrical units in the past 20 years. And it's the OB units that really are the canary in the coal mine. But what we saw right before the big, beautiful, awful bill passed was the University of North Carolina published a list of hospitals that were on the brink. Rural hospitals have been struggling to get by for a long time as the cost of healthcare has continued to go up. And by the way, There have been record profits in the insurance industry over that period of time as well.
So
So
interesting.
crazy how that happens. But the hospital where I work in northern Minnesota actually was on that list of hospitals that was at risk of closing. Now they're affiliated with the university hospital system. It's not like there's some little podunk, out in nowhere. I mean, it's a rural area, but they have resources, but still they're struggling. And that really, when I found that out, that was really eye-opening to me. Like, this is my hospital. I take care of these people. But then I look at like Louisiana, where they had 38 hospitals on the list. Minnesota had two, Wisconsin had a couple, but 38 in Louisiana. It really underlines the health disparities and how these hospitals have been struggling to get by for so long because of broken funding mechanisms, because we've got the donor states, we've got the receiver states, and the southeastern part of the country where women's health is hard to come by, where women are getting prosecuted. I don't know if you saw this headline, but in Alabama, they've been prosecuting women primarily for substance abuse issues in pregnancy, but women who otherwise are doing well, and they don't deserve this. It is so challenging to live and practice in these environments. And I think immediately after the Dobbs decision, a lot of my colleagues were saying, well, let's see how this plays out. I'm going to stay where I am. I'm here for a reason. Even if I'm in a red state like Arkansas, I'm going to fight for it. But now that it's been going on, it's been more than 3 years. Trump got reelected. Things are moving rapidly in the wrong direction. A lot of my colleagues are really considering, where am I going to go? Where am I going to feel safe practicing? Where am I going to feel comfortable raising my family? And, there's already a profound doctor shortage. People are leaving healthcare in droves. I went to get my flu and COVID shots yesterday, and there was a sign up where I checked in that said, violence is not accepted in this urgent care center. And I said to the receptionist, how sad is it that you have to post this? And she said, oh yeah, I get threatened all the time. We as healthcare providers are more likely to be harmed on the job than a police officer, because people are so frustrated and angry, and we're so divided. And some of us have been given this license to act out when we've totally lost all sense of decorum and neighborliness and the ability to communicate effectively, because we're desperate, we're angry. So there are so many factors that go into this rural hospital closure concern, but I think you are exactly right. This is the tip of the iceberg. Georgia is the tip of the iceberg. Every single state has hospitals that are at risk. And as we start to see healthcare costs rising, continuing to rise, a lot of those rural hospitals are buoyed by Medicaid funds. Medicaid really is prevalent in these rural areas where people need more care, more expensive care, more touches with the healthcare environment. I think we're going to see a lot more hospitals closing in the near future.
I have like 8 things to say.
I just talked a lot.
I'm like, oh my God, no. It's not you. It's just like the circumstances. First of all, I knew in principle that, healthcare professionals are really getting the brunt of like people's this cultural shift, exactly as you're saying, where it's just kind of been normalized that you can treat people like shit now, even though we're all fellow humans. But I did not realize it was that bad, where there's actually, like, you can actually say that you're more at risk of violence than police officers. Wow, that is so hard. How do you contend with that? Like, just as like a woman who's going to work in these environments every day in a rural place, like, have you been thinking about that from your own personal perspective?
Oh yeah. The most recent shift that I worked in northern Minnesota, we had security there. Police ended up on the unit. It was a whole event. It nearly shut the hospital down because it was a big deal. So yeah, we're always having to think about supporting each other, both physically and mentally, and thinking about what our resources are. It's really challenging, and we're losing a lot of healthcare providers. I mean, I can talk about it from a doctor perspective, but nurses, techs,
Yeah.
there's a whole group of people. It's not just about your doctor. There are way more other people who are there to support your healthcare, and they are taking the brunt of it as well.
Yeah, and I'm also just thinking from the perspective of like the next generation of doctors, like medical students or people who want to go to med school, who are like watching this happen. What is their incentive to do that? They're like going in for multiple years of schooling to then not potentially even be able to work in several states if they want to be an OBGYN, for example. But and then also having to deal with people just being terrible. And we are like, it's almost like we're taking this problem that we have, the doctor shortage that you mentioned, and just figuring out every possible way where we can make it worse instead of making it better, and then saying, yeah, let's do that instead. That is just, it's so disheartening because, you know, I'm obviously in public health, and I'm thinking about this from like even a population level perspective is like, oh my God, we've lost the USAID, we're
Yeah.
CDC decimated, departments of health are losing funding left, right, and center. Sexual violence programs have been all cut. Like, it's a disaster, right? And that's not even starting to touch like the actual reproductive health policies. So if you look at all of this in the grand scheme of things, it's almost like the world that we are creating for our children, for the next generation, like, what is that America even going to look like? Are people going to even have healthcare? Is that going to even exist? Is there even going to be expertise, or is there going to be this huge brain drain because doctors are like feeling like they can't practice in the states that they live in, or like even in the country? It's just, there's a lot of questions here, and I feel like I need to say thank you for your service because I mean, you're like actively putting yourself on the line every day. That's just very commendable. And it's not something that you have to do. It's something you're choosing to do. So I think that that's really powerful in itself.
Thank you. It's something that I have to do because I owe it to my patients. And, honestly, I love to do it. And when I talk with my kids, so my oldest son is 26. I've got 4 boys, interestingly, which I joke that's why I had to go into OBGYN to like balance my life out a little bit. But to talk with my boys and to look at what they see as the future, because they're all older and they're all bright and they're all paying attention. They're the ones who give me hope. We talk about the doctor shortage, and yeah, there are fewer people going into medicine. And in Wisconsin, we know that the number of people who are choosing to train in OBGYN are down. The number of applications are down in Wisconsin for a couple of years running now because, we can't offer abortion care because in the training sites, they don't do abortion. So we have to ship our residents out to Illinois to get the training that they need so that they can take care of their patients. So it's been a real challenge. But what I have seen is that the young people who are choosing to go into OBGYN specifically are not just doing it haphazardly. They're not going in with blinders on. They're going in understanding what the environment is, and they are ready. They're doing the advocacy work. They want to know how to get involved. They want to know where they can use their voices. They want to organize. So that's going to be the solution, I think, is giving them the resources that they need, working with them and helping to create a whole new generation of physicians. The old physicians didn't have to do any of this advocacy work. All the stuff was there. Doctors in the 80s just got paid. They got paid. They were golfing. They owned their practices. Healthcare was very different. Now doctors are scrambling. We've got the electronic medical record. We've got all this accountability stuff. There's so much extra paperwork, and there's a lot of burnout in medicine. That's my generation. The future generation can see it because it's already there. So I have hope. And that is one of the things that I'm most interested in as a physician who works with young people, is giving them those resources and connections to be able to be the future of medicine, to be able to continue to practice and lead the way.
This is the good news I needed today because, when I was in grad school, I was doing my dissertation on what the impact of being an abortion provider living in restrictive United States are. And I focused on the Southeast because, exactly like you said, that's where that's like the origination of everything. Every time Georgia does something, Texas is like, wait, hold my beer. I'm going to try and top you in terms of how bad this is, right? And it was like super disheartening. And this was like almost a decade ago, more than a decade ago. But I was interviewing like the OBGYN department at the University of Alabama, okay, which is like a giant university. And I was asking exactly about what you're saying, like, if medical students know that they want to become OBs and they want to be able to like provide healthcare, the whole gambit of healthcare that is involved in like women's health, what do you like if your medical school is not offering training opportunities, how do you think that this is going to play out? And the only response I got, Chris, and I'm not joking, was, we don't discuss the A word here. And I was like, oh my God, this is a medical school, an accredited medical school. And I was like, we're screwed. So I'm actually really glad to hear the perspective that you're bringing, because you're right. I hadn't thought about it that way. It's almost like, yes, there is a shortage, but there's also like a self-selection process happening where
Mm-hmm.
people are like, okay, I'm doing this because I'm ready to like fight. And I'm doing this not necessarily for like the cushy lifestyle that comes, or used to come rather, with being a doctor, but because I know that this is like how I'm making a difference. And I think that that's quite beautiful, actually. And actually makes me think about how a lot of what I think about recently in the light of like, impending fascism is that the only thing
Impending. I think we're there.
I know. I like to say that as like a hopeful mechanism. And as soon as I say the word impending, my brain is like, what are you talking about? But I always say that the only thing that is going to get us through is each other. Like, truly.
Yes.
Right? And, like people call it community, they call it friends, they call it family, whatever you call it. But it's like your circle of fighters and advocates and the people who are loyal to like each other and to like the America that we know that we can be. And I think that what you're sharing with me about this new generation is like, makes me feel like they're bolstering that for our infrastructure. So like creating a community within our infrastructure, which I think is quite cool, actually.
Hey, it's so necessary. And I think it's happening with our public health as well. I'm more concerned, and this is your area of expertise, about what happens with our state and federally funded public health mechanisms, because I can compare Minnesota and Wisconsin. Minnesota's great at funding public health. Wisconsin has been really dependent on federal block grants. So we've seen a lot of improvements in Minnesota, and we've just been limping along here in Wisconsin. So recently, just north of where I live in a rural county, there was a big measles outbreak. Poorly vaccinated county, 74% vaccination rate. And we were just seeing the numbers rising over and over again. They have one public health official in that entire county. And that's the case for most of the counties here in Wisconsin, especially the rural counties. So when something like this comes up, they don't have the bandwidth. They don't have the time. They don't have the resources. They can barely even get the message out. And people are depending on that. In a neighboring county, we were having a conversation about exactly this, measles. And they said, why didn't the public health department tell us? Like regular people were asking me as a physician, why wasn't public health telling us that this was happening? And I talked to the public health person and she said, I don't know how, because I don't have, I can't, I don't have the ability. So I'm more worried about public health. We've got to get over this political piece, and the line between politics and healthcare is so blurred right now. It used to be pretty well defined, but now it is all stuck together. So that means that public health officials, practicing physicians, and other healthcare providers like me, those of us who work in any part of the healthcare field, really need to stand up and say, this is what we need right now. And that's going to be the case for every single American in about 3 months when we look at the rising prices of our healthcare premiums. And that doesn't even begin to take into account what's going to happen as people drop off of Medicaid and can no longer get their ACA subsidies so they can't sign up for insurance, because all those folks are going to go to the emergency department to get their care. And the hospitals are not going to be able to pay for that. And that means that it is all going to be reflected in our healthcare costs. So it's this vicious circle that is going to continue to make healthcare too expensive and unachievable for the vast majority of most Americans.
Yeah, and I really feel like too many people are missing that point. Like we're hearing with the shutdown, for example, in Congress, like the last couple of weeks, that's all the news has been talking about, right? And everyone keeps saying like, oh, they're like arguing about healthcare. Both sides are arguing about healthcare. And then the Republicans are blaming the Democrats. And the Democrats are like, literally all we want is the $1 trillion worth of healthcare that you took away. And then the general public's like, well, if I'm not on Medicare or Medicaid, this doesn't affect me. And it's like, no, let's put on our critical thinking hats for a second, right? If several hospitals in your state have closed, where do you think those people are going to go? Like your wait times are going to get longer. Even if you are on private insurance, your premiums are going to get larger. Even if you're on private insurance, your employers are probably going to be looking at insurance burdens and being like, we need to be rethinking this. And at the same time, like you said, throw back to the beginning of this conversation, the health insurance companies are now starting to use AI models for a lot of their deciding whether or not people get care. So now, because of this thing that happened to, let's say, 25 million Americans who are on the ACA, the rest of the country is also having their healthcare pushed further along a spectrum of dehumanization, increased pricing, more rejection, less regulation in terms of processes. And it's just, it's nothing that's happening within the ACA is mutually exclusive to people who are on the ACA, right? And it's, I think that it's such a good point, is we need to almost be talking about that more, is hey, this thing that they're talking about, you might think you're exempt from, you're absolutely not exempt from it, right? It's the same way as when people who are anti-abortion are yes, we should ban abortion. And I'm like, okay, if you are anti-abortion, that's your prerogative, right? But by banning abortion, you are also banning miscarriage management. And that, to be anti-miscarriage management, is just insane. Objectively, it's
cruel. It's just cruel.
I mean, you're being kinder than I am, but I just think those people are sociopaths. But
I mean, if you don't want an abortion, don't get an abortion, but don't make it so that other people can't get health care, because it's tied into infertility care. It's tied into complicated pregnancies. Until you have walked with somebody who has a desired pregnancy and finds out at 20 weeks when they get their ultrasound that their baby doesn't have a brain or some other major anomaly is happening, they are heartbroken. They're stunned. They don't know what they should do. And then in states like Wisconsin, they have a week to get all their resources together. And if they choose to have an abortion, to get that abortion.
Mm-hmm.
It is so unfair. It is not health care. And these families suffer for the rest of their lives when they don't have time and support and compassionate ways to deal with these tragedies.
Yeah,
tragedies.
It is a tragedy. And what we're doing is tripling down on people's trauma instead of using the modern medicine that we have innovated to the point to be able to get us, to be able to provide people with basic care that other countries do every day. In fact, the US used to do it a couple years ago. And, so it's interesting because this conversation is making me think about how every time something disastrous happens from the government standpoint, they restrict access to care, they ban something, whatever it is, people are standing up and rallying in their own ways to try and make things work, to try and find ways around it, to try and continue to do the human thing, which is to take care of your fellow people, right? And I just know that we will continue to fight that. But I also know that at some point we're going to get to a point where there's going to have to be a tipping point, right? We're not going to be able to continue to fight back when our hands are always tied. So what I'm getting at is, from your perspective as a physician, from your perspective as someone who is seeing pregnant people every day or folks wanting to get pregnant, what are the ways in which you think that everyday Americans can really take action around this whole healthcare politics integration, and how we need to sort of understand that and separate it?
We've got to have these conversations. I mean, fundamentally, we've got to have these conversations. So when your neighbor says, well, I wanted the government to shut down because I don't want the illegals to get health care, you need to say, undocumented folks don't get health care, actually. And in a non-threatening way. It's easy if you live in a blue state to feel, if you live in Minneapolis or Los Angeles, to feel like you're angry with these other people. But when I live in this very red purple area, I recognize that a lot of these folks just don't know. They're not paying attention to politics. They're agnostic. They're just trying to get through the day. And yeah, I'm frustrated that Donald Trump got elected too. And they voted for him, and that makes me angry, but we've got to set that aside and look to the future. So however you can have these conversations, however you can use your voice, maybe it's in media, maybe it's on your social media, maybe it's in the local news, maybe it's volunteering for a food pantry or a local organization that helps Immigrants, refugees, whatever it is, do that thing in your heart that makes you feel good and like you're making a difference right where you live.
I think that that's super helpful and is a nice way to wrap up that conversation actually, because you're right, like neighborhoods and community, it's what we used to be, and I think it's what we need to get back to as opposed to just kind of coming in walls up and defenses up. I don't
Mhm.
blame people for having that approach because, we've entered into an age where people's basic unchangeable characteristics are now enough to have them be treated differently. So, I think that there is a lot of nuance, especially with some communities not feeling safe to do that. But you're absolutely right, is that if you are in a safe environment, if you do have the privilege to be able to have those conversations, you should be having them because that is the
Yes.
that we are going to break through the artificial walls that are being propped up everywhere, right? So, talk a
And
lot.
Carrie, the thing I didn't say is
Yeah.
maybe the most important thing, we got to vote. We have to vote. New Jersey, Virginia, every opportunity you have to vote for city council, school board, whatever it is, make a good, informed decision and get out there and vote.
Yeah, I think people are really tired of hearing about that, but it's true. That is the most influential thing we can do, right? And I think that we often forget, like, we're like, oh, it's just the presidency. No, there's like so many more local elections that are happening that actually make a huge difference. I mean, like, okay, I think most people have heard about Gavin Newsom in California, right? Like, there is an example of a local official, like a governor of a state that is actually able to create change for his state's people. Like he is the first state that has said that abortion pills will be protected via mail and stuff like that, right? Like that's a
Yes.
concrete example of how a state election is now going to impact hundreds of millions of people because those people in that state, people who move in and out of that state are now guaranteed to have access. And so I want to doubly plug what you just said. New Jersey and Virginia are about to have two major elections for which people need to sort of get active and rally. But it's not just governor levels. It's like your local Congress members, your local representatives, your school board. Exactly what you're saying, Kristen, is where this stuff really matters. And people, I think in the past took for granted that like blue areas will stay blue or progressive people will stay progressive. That is no longer the status quo. And we have to actively work to make sure that that's happening. So thank you for adding that in. That was great. And I just so generally appreciate you, not just for being on this call today and taking the time to do this, but for putting up with what is happening and continuing to fight and not just fight, but like, earlier I said, you don't have to do this. It's a choice. And you said, no, I do have to do this because I believe in it. And I think that just speaks to who you are as a person. So thank you for having that principled stance and for acting on it every day and for being a force of nature that we need, not just for Wisconsin, but Minnesota and just in the general culture of the country. I appreciate that.
Right back at you, sister. I'm proud to be in this fight with you.
Thanks for tuning in to this episode of Women in America. If you enjoyed it, share it with your network and follow us on social media at women_in America. See you next week.